So we're now focusing in on specifically the heart and how the heart works to eject blood into our two circulatory systems, the pulmonary and the systemic system. And there's two parts to this video. We'll firstly look at the cardiac cycle, the phases or the order with which the heart chambers work and how the blood moves through them. And then secondly, look at the conduction system of the heart, so how we have these electrochemical impulses that spread through the heart that make the muscular contractions occur. So initially I just want to play a little video to refresh you in terms of the order of things and how the heart actually works in the cardiac cycle.
The heart is a pump which must circulate blood through two different but interconnected vascular systems. The smaller of these systems is the pulmonary system. Blood returning from the upper part of the body is delivered to the right atrium of the heart by the superior vena cava, one of the body's two largest veins, while blood returning from the lower part of the body is delivered to the right atrium by the other major vein, the inferior vena cava. Contraction of the right atrium in each cardiac cycle forces blood into the right ventricle. This is followed by contraction of the right ventricle, which pumps blood into the pulmonary artery, sending it on through the blood vessels of the lungs. As the right ventricle contracts and pressure within the right ventricle rises, the tricuspid valve situated at the opening between the right atrium and right ventricle shuts, preventing any backflow. The pressure generated by contraction of the right ventricle soon opens the pulmonary valve and blood enters the circulation of the lungs. After passing through the circulation of the lungs, the blood, having been recharged with oxygen and having rid itself of carbon dioxide, is returned through the pulmonary veins to the left atrium. The left atrium, too, contracts, forwarding blood into the left ventricle in order to fill it before it contracts. As the powerful left ventricle contracts, the mitral valve shuts, preventing backflow into the left atrium. The aortic valve opens and blood is forced into the aorta, which distributes it to the rest of the body apart from the lungs. As the contraction comes to an end and pressure in the aorta falls, the aortic valve snaps shut to prevent backflow into the left ventricle.
So that video hopefully just refreshed you in terms of the process of blood moving through the heart chambers and the role that valves have in preventing backflow. Now here's a quick look at the specification, and you can see there we've got the two sections: cardiac cycle, specifically understanding what diastole and systole mean, and then secondly the conduction system, and actually importantly how the two of those things integrate, how this controls this. So let's have a look at those two terms, diastole and systole. So one heartbeat, every time your heart beats, excuse me, an average time of an adult is about 72 beats per minute. Every time you have one heartbeat, we have these two phases. We have diastole and systole occur. Now diastole means the relaxation phase of the heart, no muscular contraction in the ventricles or the atria, and during that relaxation phase is when the blood fills the chambers respectively. So during atrial diastole, blood fills the atria. During ventricular diastole, blood fills the ventricles. So diastole is the relaxation and filling phase of the heart chambers. And then we have systole. Systole is the contraction phase of the chambers. So again, we can have atrial systole or ventricular systole, the atria contracting or the ventricles contracting. And when systole occurs in one of these sets of chambers, blood is pushed or ejected out of them. So diastole and systole, two terms you must clearly understand. Here's a little overview. So the cardiac cycle itself is what we measure. If we use our manually or use a heart rate monitor, we take our pulse, which is basically the number of these cycles that occur per minute. So 72 beats is 72 cardiac cycles per minute. And we've talked just previously about the two phases, diastole and systole. Diastole typically takes about half a second, so 0.5 of a second, so it's quite quick. But even quicker we have systole, so the contraction phases of atria and ventricle contracting takes 0.3 of a second. So in total a single cardiac cycle might take 0.8 of a second. So here's just a visual perhaps way of looking at it. We've got atrial and ventricular diastole, or at least part of the ventricular diastole, the passive part of it, takes about half a second. And then we've got the atria and the ventricles contracting, takes 0.3. So it's very much a process. This diagram shows, the cardiac cycle, but its starting point is assumed that atrial diastole has happened, i.e., you can see here from this picture that the two atria have filled with blood. So we've had atrial diastole when filling of the atria occurs. And then we're moving into sort of this first stage here, which looks at ventricular diastole. So how do we fill up these ventricles with blood? Now, there's actually two parts to ventricular diastole, or ventricular filling. The first part we describe as passive. Now, passive or active refers to whether there's any muscular contraction or not. In the passive filling of the ventricles, blood basically has got, the atria have got so full of blood that the pressure has built up and forced these two atrioventricular valves open. So the pressure's built up here, forced the valves open, and blood starts to seep through into the ventricles. There's no contraction occurring anywhere in the heart at this point. It's very much a passive process, just because pressure is built up. More blood coming into the atria means greater pressure here, and the valves get forced open. So a lot of the blood will go into the ventricles as part of this, about 70%, which leaves us about 30% in the atria. So how do we get that blood, remaining blood, down into the ventricles? Well, we have atrial systole occur, atrial contraction. So these two top chambers both contract and squeeze the rest of the blood down through the same valves and into the ventricles, so that at the end of these two processes, blood has moved from the atria down into the ventricles. So that's ventricular diastole, ventricular filling. And now we've got the ventricles full of blood, we want to make sure that it travels out of the aorta and the pulmonary artery to go to the lungs and the body respectively, and not go backwards into the atria. So we prevent backflow, remember, by these valves snapping shut. So blood has come through them, and when pressure builds up here, basically almost like the blood gets behind the valves, make them snap shut, and blood cannot now go back up into the atria. Same happens this side. So the AV valves close to prevent backflow, and then we have ventricular systole, or the ventricles contract. So the bottom two chambers now forcibly contract, pushing the blood out through the pulmonary valve and the aortic valve to the pulmonary artery and the aorta. And the ventricular contraction basically ejects blood out of the ventricles into the two respective circulation systems. Now here's an exam question, a fairly typical exam question. Describe how the blood travels through the heart in the following stages. It gives you the stages, and you now need to use those three titles to describe what occurs. And I want you to pause the video and in your own time have a look at these, basically describing what happens in the chambers and what happens with the valves in diastole, what happens during atrial systole, and what happens during ventricular systole. Remember, this is when atria fill, this is and the ventricles will passively fill here, and this is when the ventricles will actively fill because of the atrial contraction, and this is when the blood is ejected from the ventricles out of the heart altogether. So make sure that you can understand the process and the order of these things in terms of blood flow, chambers, vessels, and valves. So just to move again into the second section, so we've looked at the cardiac cycle and the order or the phases with which blood travels through the heart. Just now to finish on the conduction system, how we electrically or electrochemically control that process. And you can see from this diagram here, we've got different processes, state 1, 2, 3, 4 and 5. So it's important we understand the process with which we use this conduction system to control the cardiac cycle. Just going to show you a very short video to try to demonstrate this. So here we have this amazing heart contraction process, and you can see the valves, the pulmonary valve there and the two AV valves. What we're adding to this video now is the conduction system, starting with the sinoatrial node, or sometimes called the pacemaker, and this is a group of really specialized cells in the wall of the right atrium which coordinate the contraction of the heart, and it's very important that we influence and we affect this SA node. Particularly when we exercise, it has to send out impulses through the heart much quicker. So now it's slowing down to show you the route of the impulses. Importantly, from the SA node, an impulse goes down to the AV node, but it also spreads through the atria. So from the SA node down to the AV node, down through the septum, the bundle of His, and then dividing into bundle branches which take you to the left and to the right side of the heart, what we call the Purkinje fibers. Now I know this spelling with a P-U-R rather than P-E-R, but Purkinje fibers. So SA node, AV node, bundle of His, bundle fibers, and the Purkinje fibers. So an impulse will spread from the SA node to the AV node and through the atria to create atrial systole. It will then continue from the AV node down the bundle of His to the bottom of the heart before going up the Purkinje fibers to create ventricular systole, ventricular contraction. So atrial systole up here, ventricle systole bottom to top down there. This you might recognise from Casualty or whatever, that's the QRS wave. So our video animated the process of electrical conduction down through the heart, the SA node, the AV node, the bundle of His, down the septum there, dividing into the left and the right side and going up the Purkinje fibers. So let's look at this closely. From the SA node to the AV node, what we see here, the purple is depolarization, which means the impulse is spread across the top two atria. So as the impulse gets down to the AV node, the atria will contract. And then from the AV node, so this is our atrial contraction, our atrial systole, and then from the AV node it goes down the bundle of His, so it moves down the middle of the septum. From the septum it goes down to the left and to the right side, to the bottom of the heart. Now from the atria we want the blood to travel top to bottom, so the contraction actually goes top to bottom. From the ventricles we've got to somehow eject the blood upwards out of the heart, so the impulse goes down to the apex, the bottom of the heart, before spreading upwards up the Purkinje fibers, which will make our ventricles contract bottom to top, which is obviously what we want. So you need to get yourself very familiar with all this language and the process. Atrial systole, ventricular systole, atrial systole, ventricular systole, top to bottom, bottom to top. Now here's a table to try to pull this all together, because you need to understand how our conduction system fits in with the cardiac cycle. So these are the stages that we talked about in terms of atrial diastole, the atria filling, the passive filling of the ventricles, the active filling of the ventricles because there's atrial systole to squeeze out the rest of the blood, and then eventually the ventricles contracting to eject blood out of the heart. Here's our explanation, which includes what the valves are doing also. Again, stop the video and read that. And importantly, let's look at the conduction system. Now, during diastole, now we know that diastole is muscular relaxation. The chambers are relaxed. When the chambers are relaxed, there's no electrical activity, there's no contraction, and therefore it makes sense that at this point, there's no conduction system activity. It's only when we have atrial systole, that active filling, the blood being squeezed from the atria down to the ventricle, that we have some stimulation and some activity in our conduction system. So the SA node sends an impulse down through the atria to the AV node. That is what causes atrial systole, the atria to contract. The AV node then sends the impulse down the bundle of His to the bottom of the heart and up the Purkinje fibers, and bottom to top, remember. And that is what causes and controls ventricular system, where the ventricles contract bottom to top to push blood out of the heart. So questions will typically come Just talk about the cardiac cycle, just talk about the conduction system, or explain how the conduction system controls the cardiac cycle.